வந்தீங்களா? ஹலோ பேசுங்க.
ஹலோ, அவங்க மியூட் பண்ணிருக்காங்க.
அவங்க மியூட் பண்ணிருக்காங்க நம்மள.
சாரா, can you hear me?
It's audible.
Audible, right? Yeah, okay. So, okay, fine. Done.
Yeah. Yeah. If it is like, okay. I'll just talk to Mark for 1 second. You know, you also can do everything you work with him now. Yeah, and big people are there on that. Yeah. 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 Yes. I agree. Yeah, I'll ask him.
Hello? हेलो हेलो सुने नहीं दे रहे ना? नहीं ये आईपैड में कनेक्शन करके रखा होगा वो, मतलब उसमें क्या नाम, रुको मैं उसको डिसेबल करता हूँ। ब्लूटूथ ऑन करके रखा होगा। हेलो हेलो, क्या है, मेरे को आवाज नहीं आ रहा है। फिर मेरा कैसे टेस्ट करूँ?
हेलो, आवाज आ रहा है? आ रहा है ना? हेलो।
हाँ भैया आ रहा है अभी।
ओके, डन डन डन।
मेरा
ओके।
वीडियो अच्छा आ रहा है?
हाँ, अच्छा आ रहा है, अच्छा आ रहा है।
ठीक
ठीक
है
है,
ठीक है।
ठीक, ओके।
ஹலோ நான் கட் பண்ணிக்கிறேன் இருங்க. ஃபோன் கட் பண்ணிக்கிறேன்.
இது கேமரா மாற்றி டவுட் தெரியல, டவுட் இல்லை, வெப் கேமரா போகுது.
கேமரா கிளாரிட்டி இருக்கா தீபா?
இருக்கு சபரி.
கிளியரா இருக்கா வாய்ஸ்?
வாய்ஸும் கிளியரா இருக்கு. சபரி, ஆனா திஸ் இஸ் த கான்ஃபரன்ஸ் ரூம் இல்ல?
நம்ம ரூம் சேஞ்ச் பண்ணிடுவோம் சார் ரூமுக்கு.
நீ அங்க மாத்திட்டு எனக்கு லைவ் லிங்க் கொடு.
ஓகே.
நீ அங்க மாத்திட்டு லைவ் லிங்க் கொடு எனக்கு.
இதே செட்டப் தான். இந்த சிஸ்டத்தை ரிமூவ் பண்ணி அங்க போட்டுருவேன்.
அதான் நீ மாத்திட்டு அங்க போயிட்டு எனக்கு செட்டப் பண்ணிட்டு ஆன் பண்ண.
ஓகே ஓகே ஃபைன். restart பண்ணிருக்கேன். device. எனக்கு பேசுங்க.
Sabri, can you hear me?
Yes, clearly. From our side,
Yeah, I can hear you. Yeah.
clearly. Okay. கட் பண்ணுங்களேன் ஒரு நிமிஷம். ஒரு நிமிஷம். ஹலோ.
Sabri, ஒரு few seconds lag ஆகுது, but it's okay. ஃபோனுக்கும் அதுக்கும் difference தெரியல.
Okay.
It's okay now. Can you hear me?
Okay. Yes, clearly.
Okay.
We can able to hear you clearly.
Yeah, I can hear you. Yeah.
Okay. Bye.
लोग मेरे को म्यूट करके रखा होगा उधर से। हाँ मेरा आवाज आ रहा है तो उधर से आवाज नहीं आ रहा है मेरे को। हाँ बोलिए।
अभी आ रहा है?
हाँ आ रहा है। ठीक है ओके। वीडियो कैसा है? वीडियो लैपटॉप का कैमरा है। ओके सर।
Rapid will give us a yes or no thrombectomy also. So will VCI, but Brainiomics doesn't. So that's how it is.
I'm not going into those
No, no,
details.
what is it among the three, which is the best? Of the three, which is the best?
VCI.
Vijay is the best.
VCI is the latest one, but it is not as
stream.
No, sir, it's live stream. This is the YouTube to this
Hello?
one.
Yeah, Madan. Hello? Am I speaking to Mohan Krishnan? Madan Krishnan, please? Hello? No.
Mute now.
It was not there. It was there.
Sir, it's all live streaming.
Yeah. No, he's not there. Good morning, sir. Good morning, sir.
Hello, namaste. Dr. Reddy, Dr. Pratap Reddy.
Chairman, sir, namaste. Namaste, sir.
Namaste. How are you? How are you, sir? Madan Krishnan here.
Dr. Satish Chandra here, sir. Yes.
Program of the for the group and for the country.
We are very happy, sir. Today you are able to spend some time with us, sir.
And definitely, I'm very happy that
Thank you, sir. Thank you very much, sir, for your time.
Medtronic is giving a full support.
Yes.
It will make a significant impact.
Very important event, sir.
Join in a few minutes.
Yes.
ऑन करते हैं.
Good afternoon, everyone. We shall just begin in a couple of minutes, waiting for some of the media fraternity to join in. So just kindly bear with us. Thank you once again for those who have already joined us. And thank you, dignitaries. Just a couple of more minutes before we begin. Thank you. A very good afternoon to all of you, especially the members of the press. Thank you once again for joining us this afternoon. I welcome you all on behalf of the Apollo Hospitals Group. Apollo Hospitals Group has always been a pioneer in leading technological advancements in the field of healthcare. To add another feather to its hat of advanced patient care methods by adopting technology, Apollo Hospitals announces its partnership with the world's largest healthcare technology company, Medtronic. This association has been a joint effort towards their endeavor for faster, safer, and better stroke management and is rightly being launched on the World Stroke Day, which is today. Today, we have the following dignitaries with us to address the media. Dr. Pratap C. Reddy, Chairman, Apollo Hospitals Group. Dr. Preeta Reddy, Vice Chairperson, Apollo Group of Hospitals. Ms. Sunita Reddy, Managing Director, Apollo Group of Hospitals. Dr. Satish Chandra, Senior Consultant in Neurology and Advisor, Apollo Institute of Neurosciences. Mr. Madan Krishnan, MD and VP, Medtronic Indian Subcontinent. Before we ask all the dignitaries to address the media, here are a few guidelines that I would like to ensure for the virtual press conference so that there is smooth streaming of the entire process. We request all the media personnel to be on mute while the press conference is on. For the Q&A, please select the raise hand icon, which is at the bottom of the screen, on your screen, for the Q&A session to ask any questions. It will be on first come first basis. For the Q&A session, we will also be joined by Dr. K. Hari Prasad, who's the President, Hospitals Division, Apollo Group Hospitals, and Dr. Anupam Sibil, the Group Medical Director, Apollo Group of Hospitals. While asking the questions, please mention your name, the city, and the publication of the media house. So, without any further ado, and to tell you more about this engagement, I would like to request Dr. Satish Chandra, Senior Consultant in Neurology and Advisor, Apollo Institute of Neurosciences, to share details on the next level of stroke management. Dr. Satish Chandra comes with over 40 years of varied experience, and it's nationally and internationally recognized for his contribution in the fields of epilepsy, neuroinfections, neurotuberculosis, and HIV neurology, CNS dominating disorders such as multiple sclerosis and neuromyelitis optica, etc. Over to you, Dr. Satish Chandra, to address the media. Thank you.
Good afternoon, sir. I bring the greeting from Bangalore on this World Stroke Day. Respected Chairman of the Apollo Group of Hospital, the Vice President of Medtronic Indian Subcontinent, Madhu Krishnan, the Vice Chairperson of the Apollo Hospital Group, Preeta Reddy, Managing Director, Apollo Hospital Group, Sunita Reddy, Joint Managing Director, Apollo Hospital Group, Sangeeta Reddy, Dr. Hari Prasad, the President, Hospital Division, Dr. Anupam Sehgal, Group Medical Director, Apollo Hospitals, Print, Electronic, and Social Media. And friends, today is a very important day. We are having in the Apollo Hospital Group, we are jointly with Medtronic launching a very important development in the field of stroke. Let me have the first slide, please. Stroke is a very common disorder which accounts for almost 1 in 4 of above the age of 25 suffer from stroke during their lifetime. It is the 4th leading cause of death and the 5th leading cause of disability in this country. We always talk about the prevalence, and what I wanted to say, it is 3 times more common in the urban compared to the rural area. And to this population of 1 in 4 above the age of 25, we are adding every year 1.8 million people suffering from stroke in this country. The stroke units are predominantly available in the urban areas, mainly in the private hospitals. Even Indo-US National Stroke Registry has said that the rate of IV thrombolysis is as low as only 11%. And the stroke rehabilitation is not well developed at all in India due to the lack of personnel. Next slide, please. When you talk about the stroke, the time is brain, and the stroke outcomes are always time dependent. So what should be done? Spot the stroke and stop the stroke. That should be our slogan. How do I spot the stroke? Next slide, please. There are signs which are very, very important. First, when we are talking about the face, which is maybe deviated, showing the weakness on one side, arm weakness or leg weakness, the speech problem, and then the next slide, we have 2 other additional important, be fast, that is balance and also vision, loss of vision. These are the 4 or 5 cardinal signs, and we have to reach the hospital in time. Then only we can save the patient. Next slide, please. Then there are some mimics which are almost mimicking the stroke. So one needs to be aware of that. It could be epilepsy with weakness on one side, or a brain tumor, or a subarachnoid hemorrhage, or sometimes a blood clot inside the brain following the trauma can mimic like stroke, and one needs to be aware of that. Next slide, please. What is the important aspect? When we assess the patient in emergency, we always grade them depending upon the disability. The next important thing is goal in the imaging. Imaging plays a very important role. It is primarily to exclude the intracranial hemorrhage and make the alternate diagnostic for the symptoms, and also to look for any contraindication. We always identify the influx and also look at the core as well as the core volume. Next slide, please. What is important is door to treatment, which is extremely important, and door to needle, which is very, very important. This should be done within dose to needle as for possible, which should be within 60 minutes. Most often we are able to reach in 45 minutes. So our goal should be directed to get the patient as early as possible so that the needle could be inserted within 1 hour. What does it involve? It involves, next slide please. So whenever the needle patients are brought there, our major objective should be there is a blood vessel occluded and hence the blood supply to the brain is reduced. So what should I do? We should re-establish the blood flow to that area, and that is called the reperfusion. And to re-establish the blood flow, we have to use thrombolytic agent, and that is the basis of thrombolysis, wherein we inject agent within the time so that the clot would be resolved. That is what is the management. But what should it involve? Next slide, please. So it has a flow chart, and this flow chart is extremely important. I'm not going into the details of it, but what is important is the time is brain. That is why the thrombolysis, we have to do it within the golden hour. The golden hour is about 3.5 hours. Now it is extended up to 4.5 hours. We must get the patient as soon as possible, and thrombolytic agent should be given. But if the perfusion is good, then we need to look at the thrombectomy, which is an endovascular treatment, which can be done in these patients even up to 24 hours. And that is what is very, very important, to get the patient early and start the treatment. And the treatment, if it is started early, we can reduce the disability and the mortality very significantly in the management of the stroke. Next slide. So, how can we reduce this time? Is that the very, very important aspect? To reduce the time, now we need AI-based stroke pathway. That is, artificial intelligence and machine learning has come in a big way now in the healthcare industry. And it is from the diagnosis, even for the drug development and the discovery, it has played a very important role. How can we use AI based in the stroke pathway? And that is what is important. And in this, now we have a Medtronic with us. We are partnering with Apollo Group of Hospitals for about 300 scientists all over, neuroscientists all over the country, to adapt this AI-based stroke pathway. How can we go about it? This is a very rapid, this is called a rapid, is one of the software which is being used. Next slide, please. The aim is here to standardize the imaging selection of the patient. We have to standardize this, irrespective of the availability of the radiologist or the interventionist. We need to standardize now, so that the uniform in the assessment and the management is established. And this can be done by using a software. And there are 3 types of software which is available in the market now. But what is important is the rapid software is being most extensively studied. And it is also used in number of RCTs already for the stroke. And hence, this is being proposed for the Apollo Hospital in partnership with the Medtronic on this very important day of the World Stroke Day 2020. Next slide, please. So this rapid stroke already it has been used in 1,600 hospitals, and 1 million scans have already been done across the 50 countries now. And there are 14 major clinical trials which have already been done. What is important is it's very easy to install within 2 to 4 weeks, and it is the fastest processing time, which is 30 seconds to 3 minutes, and it is customizable very easily. Next slide, please. This can differentiate from an intracranial hemorrhage from that of an ischemic stroke. Next slide. It can easily say whether it is a hemorrhage or an ischemia, which is a reduced blood supply to the brain, which is a very important aspect for the next step. Next slide, please. It can use in the calculation of the infarcted area by using aspect score. Aspects is one which is commonly used, and this aspect score can be rapidly be done using this rapid software without any mistake, and both qualitatively and quantitatively we can even assess the perfusion. Next slide, please. It can be used even for the angiogram, and then it works with any CT scanner, and it corrects the images and identifies the aspects and also differences between acute and the subacute ischemic areas. Then the angiogram is used to identify the next slide, identify the large vessel occlusion. very easily it can pick up the large vessel occlusion and where exactly the occlusion is there. Next slide, please. And we can also triage the patient and transfer the decision. What is important is using this AI, we can triage the patients early and take the decision very early without wasting time. And that is why this speedy triage and transfer decision making is the most important aspect of this AI-based technology. Next slide. So here we can see that there is a very high specificity regarding the large vessel occlusion, and it is also highly sensitive. It is 97% specific and 94% sensitive. And vessel stenosis can be identified. That means the narrowing of the vessel, the occlusion, blockage in the vessel can be easily be identified, and normal vessel anatomy could be seen very beautifully within a very, very short time. Next slide. Normally, next slide. The perfusion, next, with the MRI, we can easily identify the area and to look at the mismatch between the diffusion and the perfusion scan. And the area which is pink and area which is green, that is a very, very important area which we need to identify. And this rapid helps us in calculating the mismatch between the diffusion and the perfusion scan, and also to help us to calculate not only the qualitative way, but also in a quantitative way, so that you know the volume of the ischemic zone which is there. Next slide. So that is important. But how do we set up this? The setting of this is a very, very simple, and there is only a node which has to be introduced. And this network has to involve a node which helps us in identifying. Next slide, please. So AI-based technology, with that, we will have a best outcome for the stroke management. It has the shortest treatment time. What is important is door to needle and puncture time is reduced very significantly. What is normally taken for about an hour completely is reduced now, even between 3 minutes to 10 minutes time. And there is a tailored approach to each patient. Accurate assessment is possible in the shortest period of time. That is what is very important. Then faster decision making. We can make the decision regarding the AI aspects, both qualitative and quantitative, perfusion mismatch, and also large vessel occlusion. And with this, what can be achieved is we can treat more stroke patients, optimizing the stroke protocols, and also with the regional telework network, we can reach the periphery. The first one is Apollo Hospital now. We are the first one in the country to get this AI-based protocols and use this. With that, we can bring a paradigm shift in the comprehensive management of the stroke. And there will be uniform stroke program across all the Apollo hospitals across the country. So thank you, sir, for bringing us this technology to us so that we will be able to manage many more patients and help the community at large to serve these patients with a very rapid way. Thank you very much, sir.
Thank you. Thank you, Dr. Satish Chandra. May I now request Ms. Sunita Reddy, Managing Director, Apollo Hospitals Group, to share her insights on AI in stroke management.
Good morning, ladies and gentlemen. It is a pleasure to be with you this morning. Today, we celebrate World Stroke Day. And really, it's not as much a celebration as it is a dedication to what we think is one of the most important organs in the human anatomy. Apollo's mission has always been to provide the best in clinical care to all our patients, whether we're dealing with the brain, or whether we're dealing with the heart, or whether we're dealing with cancer. This has been our mission. Let us provide the best in clinical care. So today, as we on World Stroke Day, we are here to focus on what is much more than just an organ. It is our brain. Our brain is so powerful. It is a supercomputer in its own way. It has 86 billion neurons, and information in the brain travels at 268 miles per hour. And why is this important? It's important because it affects your decision making, it affects how you react, and it affects your motor skills. And as we think, deeply about the brain, The brain, with its combination of neurons and atoms, it produces enough energy to light up a bulb. And that's really, it is the center of energy. It is the center of light for all of you. The brain is constantly working. Even while we're asleep, the brain is working, which is why, we need to be more careful, more cognizant that these strokes, these thrombolytic issues can happen even in the night. A stroke that happens in the night, most people get very worried and, they don't think about what are the consequences of this. We must remember that every minute that we lose 1.9 million brain cells, which is why it is extremely important that today we are emphasizing on World Stroke Day the importance of getting good care, timely care on time. So why the brain? If you look at statistics, strokes to the brain are the leading cause of disability, and especially in the young. So we're not talking only about the leading cause of mortality, but we're talking about useful adults who will somehow, because of a stroke, become disabled. And which is why at Apollo, the way that we think about this is our focus on prevention, our focus on cure, and our focus on rehabilitation. So our focus on prevention comes through our preventive healthcare package, through ProHealth, where we look at every aspect of the human body and see that everything is synchronized and works beautifully together to see that you have this holistic individual life. We also look at cure protocols, and today we are focusing on strokes and what we can do in that process. So we've tied up with Medtronic, and I'm truly grateful for this wonderful combination. I think it's a symbiosis of artificial intelligence with what we know as clinical, as doctors, as people who've worked for over 35 years dealing with the brain. This symbiosis is going to bring us the technology that will enable us to provide clinical protocols in the most timely manner and help us deal with these strokes in a way that we could never have done before. I think everyone has emphasized the importance of the golden hour and the importance of treatment within that golden hour. So today with Medtronics, we will be able to provide that treatment and make sure that we do not lose lives due to the loss of timely care. I would like to end by saying that we are who we are because of our brain. The brain is really one of the most important organs in our body. And today we dedicate this to you, to your well-being. And I hope that together we can make this world a much better place. And so that people do not have to worry about what will happen during this stroke, because we're here to provide the best and will continuously do so. Thank you very much.
Thank you, Sunita ma'am. May I now invite Dr. Preeta Reddy, Vice Chairperson, Apollo Hospitals Group, to share her views on the Apollo Medtronic partnership on this World Stroke Day. Ma'am, you're on mute, I guess. We're not able to hear you, Preeta ma'am. Saurabh, can you check if you're able to hear ma'am? I can't hear ma'am.
Can you hear me now?
Yes, yes, ma'am. Now we can hear you.
Okay, okay. So the technology glitch. So for everyone on this call, thank you so much for your time. And Madan, it's particularly a pleasure to talk to you and have you interact with us. The brain and the heart are, the most important part of our existence. Apollo has done amazing work in heart care simply because we knew that it was important. It's our commitment to our patients. Today, to focus on care of the brain, to focus on what we can do in that area is significant. And we know that data shows that the incidence of stroke, the incidence of brain attacks is actually becoming so much more globally. And Medtronic has done some amazing work, and we have watched their focus, their success on the kind of work which is happening in this area. I think a partnership is important because in today's world, the sharing of knowledge becomes totally relevant. Technology has to work hand in hand because that's the only way where we can literally save lives. In the incidence of strokes, speed is the key. If we can intervene at the right time and we can do it well enough, then what happens is that the patient benefits, and we are all here for the patient's benefit. And that is extremely important. Again, can we scale up? This program is being rolled out across the Apollo network, and that again is what the back end, the amount of work which has gone into it has been credible. The numbers speak for themselves. And it immediately, because of our focus on AI along with Medtronic, we will be able to work together on research. We will be able to take our data, collate it, and better the process, better the outcomes. Because at the end of the day, it's the clinical outcomes which really matter. And early intervention, the best-in-class clinical outcomes are what we have to commit to our patients. I know for a fact that this program is, it's passed its FDA test. It's being scaled up in many locations across the world. But this is the first one in Southeast Asia. And for that, I'm so happy and delighted because Apollo has always focused on the best-in-class clinical interventions and seen that we partner with the best companies worldwide. Medtronic is second to none. We have watched them. We have been part of, a lot of work which they do. The other excitement here is that it provides a training ground. Clinicians across the Apollo group, clinicians from literally different parts of the neighboring countries can come to us for training because it will evolve and develop as a training center. And the network provides them that kind of locational advantage, clinical advantage, volumes for AI and ML, and that again positions us, as best in class and better than a lot of other institutions. But having said that, I think we're very committed to this. We feel it is one of the most important interventions for patients, because if decision support for clinicians can happen acute and if it can happen fast, that makes a huge difference because, the damages, the collateral damage which happens during a stroke can be minimized. So thank you all for all of us as partners coming across to do this for our patients. We are committed. We sometimes we think with the heart and we work with our brain, but between the kind of work which is being done, I think both areas of the human organs need that kind of focus. And today, focusing on the brain, focusing on strokes, which is a brain attack, as much as we do with the heart attacks, has truly made us happy, and it's given us, the intense focus into emergencies and patient care. So thank you all for being there. And as always, the members of the media, your support is so valuable because as an institution, we've grown together over the past 37 years. And this is a milestone. It's truly path-breaking. And thank you for your time and commitment.
Thank you, ma'am. Now can I invite Mr. Madan Krishnan, Managing Director and VP, Medtronic Indian Subcontinent, to share his views on the partnership and how Medtronic's AI tech will deliver faster and safer care in patients of acute stroke. Over to you, sir.
Honorable Dr. Pratap Reddy, Srimati Preeta Reddy, Srimati Sunita Reddy, Srimati Sangeeta Reddy, Dr. Hari Prasad, Dr. Anupam Sipal, Dr. Satish Chandra, honorable members of surgeons and physician attendees, leaders of media who are also attending the event, greetings. I'm happy to be with you on this meaningful World Stroke Day. I'm proud of our association and partnership with Apollo Hospital, two world-leading organizations coming together, in this case, to improve the standard of care in India for early diagnosis, timely treatment, and better outcomes towards stroke. And I'm really privileged to be here with you and also humbled by what a concerted effort by these two global giants can achieve to the people of India. Our research is showing that every day, every single day, more than 4,500 people in India are afflicted by stroke. And unfortunately, as of now, not even 2 to 3% of them are getting the right care at the right time, which is leading to thousands of deaths daily we are talking about, and disability, varying degrees of paralysis, which is a big drain and a very poor outcome for quality of life for the patient and also for the family. This is also a huge drain, economic drain for India, which we cannot afford. What we are committed here is to ensure that we bring the latest, the state-of-the-art technology and the treatment and training, which is available possibly in the latest or the most advanced centers in the US, here in India, across the Apollo chain of hospitals. What our effort will be to ensure that the training and the protocols are set in the optimal manner. The teams are ready to address, to reduce that door to needle time, as Dr. Satish mentioned. And back with the technology, technology will allow us to do faster, accurate diagnosis. Using the technology, the scans will be distributed electronically. Physical presence of a physician will not be needed at that point to diagnose. And the faster decision-making, every minute counts. Every minute, research shows that 2 million brain cells or neurons are destroyed or damaged. So every minute counts, every second counts. I also have a big appeal to the leaders of the media, journalists and media leaders on the call. Diagnosis is a big challenge in the stroke preparedness and through addressing stroke. Often it is confused with migraine or headache or sinus or even heart attack in many cases. So Dr. Satish nicely explained the mnemonics, fast and be fast. I really request your support to make it widely known. What are the symptoms to look for? And the time is of essence. Honorable organizations like Apollo Hospital here, we are going to create a comprehensive stroke center, end-to-end capability. We'll also work with Apollo hospitals to ensure that the hub and spoke models are also created. Research is also showing that when the first stage of treatment is given, which is a thrombolytic injection, in many cases, in certain class of patients, the intervention, which is a mechanical thrombectomy, can be done even up to 24 hours. So there is a window which is being made even bigger. Idea is to act fast and to stop stroke. Idea is to ensure that we create the awareness, because the capability, the best-in-class capability is here in India, and the Apollo physicians, surgeons, and the nursing staff are all being trained, and we'll work together as an integrated team, Medtronic and Apollo, to ensure that we create a meaningful difference to patients afflicted with stroke, taking healthcare further together. Recently, we also announced as Medtronic an investment of $160 million, 1,200 crores, to set up our largest R&D center outside the US in Hyderabad. The center is also actively involved in novel therapies for varying disease states, including stroke and robotic assisted surgery. And I think the technology and the partnership is what will make a huge difference. And I'm confident that this step, two giants coming together with the exceptional patronage and support from Sri Pratap Reddy and the team. I'm so inspired. My first meetings with Srimati Preeta Reddy and Dr. Hari Prasad. That's how we sow the seed of this partnership. And I'm always inspired by Apollo leadership's commitment to higher quality partnerships, products, and outcome-based approaches. I wish the joint venture all the best. Really humbled by this effort. Will be committed to ensure that all the support is provided to make this partnership into a great success. Let's continue to work together to address this big disability creator for India, Apollo and Medtronic working together to ensure that we take healthcare further together. All the very best, and thank you.
Thank you very much, sir, for sharing these insights. I would now like to invite the visionary who began the journey of Apollo Hospitals with a mission is to bring healthcare of international standards within the reach of every individual and being committed to the achievement and maintenance of excellence in education, research, and healthcare for the benefit of humanity. Dr. Pratap C. Reddy, Chairman, Apollo Hospitals Group.
Keyur sir is muted. Somebody needs to unmute.
Yeah. Sir, you'll have to.
I sincerely appeal that on this day, World Stroke Day, it is clearly to be told to people saying stroke is a very common incidence in human life. 1 out of 4 people get this, and most of the people ignore it and then develop disabilities and sometimes even death. So this is where I think we can make a significant impact. I want to compliment the great work that Medtronic does in many things in healthcare. We know they're number one in innovations in healthcare, in cardiology. Now we're talking with them on stroke. I compliment them for the very many new innovations that they have brought in healthcare. And I'm happy that they have started a large process in Hyderabad. So I think we'll be closer to them, and I think closer to developing newer methodologies and making a significant impact in people's life. I think the media and the public should very clearly know that way back in the 2015, 2016, the World Economic Forum first announced saying the second decade of 20th century, that is 2020 to 2030, is going to be a very serious concern for people because of non-communicable diseases. What are these non-communicable diseases? Diabetes, heart attacks, strokes, cancer, and infections. So, but many, as far as Apollo is concerned, we were preparing ourselves and made many things to see how could we face this. They also said in the second decade, the healthcare will have a greater inputs to manage people by way of artificial intelligence, automation, and robotics, and 3D printing. But I'm happy today, Medtronic is bringing the artificial intelligence to manage these strokes and make a significant impact in physical ability as well as their life on people. I think it should be very clearly taken that people, when they get these symptoms, as Dr. Satish Chandra pointed out very clearly, I think they should immediately call their doctor or immediately call. Now we have developed this 24/7 Apollo, which has already touched more than 20 million people more than 14 million people contacted for their corona scan. That epidemic which came, which probably blinded people for the NCDs. But NCDs have not gone. NCDs is still began and it will still grow. Today they're saying around 70% of the deaths are from NCDs, but by the end of the decade, it's going to be 80% of the deaths, I say, will be from NCDs. And the cost burden for the world is $3 trillion, and for India, it's going to be $3.8 trillion, which is more than 50% of the GDP of our country. We're struggling, asking the government to take it to 1 to 3% of GDP for healthcare. Where do we get 50%? And the good news is, like what Medtronic has brought now, using artificial intelligence, you can detect the disease early, treat it more effectively, so that people, number one, may escape from becoming a disability, and secondly, even death, which will make a significant impact in this part of the world mostly, because the so-called strokes and heart attacks, I pointed out way back in the American College of Cardiology that Indians get a heart attack at a very early age. They told me, Dr. Reddy, Indians don't know the date of birth. I said, come on, shut up. They not only know the date of birth, they know the star under which they are born, along with the date of birth. So later, many researchers have now proven, and in heart disease is different. So I think even in strokes, it's the same. It doesn't come, for them, it comes 60s and 80s, but we were getting it in 30s and 50s. Now it is coming to 20s and 40s, the strokes and heart attacks. So I think it's very important. Who are these? These are breadwinners in the family. So I think whatever we do, whatever Medtronic and today Apollo is doing, is significantly impact the family, bring happiness into their family, bring productivities into places where they work. Ultimately, it will make a significant impact on the nation's GDP. So I think these three important things are there. But what is important is we have the best solutions possible using artificial intelligence. No matter if they come in time, we can give them good recovery, probably no disability at all, as Dr. Satish Chandra said. And I'm sure all our neurologists will all form a team, because we have probably the largest number of interventional neurologists, and we're training more of them. So I think this could be easily available now, not only in places in the metros, we should be able to take it even to the districts, and so that more and more people will have access to this technology. So I think it is very necessary. This is where I ask our medical profession to say that time is the essence of this. Like in heart, in brain, they have specified saying every minute some million plus neurons will be lost. So it's a tremendous thing, and the way where it is lost makes a more impact. So I think to clearly tell, saying, if you come on time, you will have a great reward for yourself, for your family, for a place you work, and for the nation itself. So I think I compliment Medtronic, who have done so much of work in medical technologies that have made a significant impact. And I am happy that we are working with them. We'll work now for the patients' better outcomes. And more importantly, we would like to work with them to see what can we do by way of doing clinical studies as well as the research in these, which can impact the disease per se. This is where I'm happy Dr. Satish Chandra, who has got wide experience in research and innovation in neurology, is heading this program, and the entire gamut of medical people with Dr. Anupam Sibal following this, and they will all see to it that we would implement it in almost all of our hospitals as quickly as possible, and have not only the technology, but the people who know how to do interventional neurology possible. So I think I'm very happy that we're bringing another newer aspect for betterment of people's ability, betterment of people's in this critical times when if a young person gets a stroke, if you can revive him, if you can go back to his work, you have made his family happy, you have made a difference to the country. So I think in all of NCDs, we are working very hard. We've done a lot of things for the heart. We all know that I started the entire Apollo programs or bringing this change in healthcare system because I lost a young man who couldn't afford to go to US for his heart surgery to Dr. Cooley. But then, because he couldn't raise $50,000, today we have done the largest number of coronary bypass surgeries and largest number of beating heart surgeries, becoming number one in the world. And I'm sure with better adaptation and wider usage of this technology that Medtronic has provided, artificial intelligence, I'm sure we'll be able to help a lot of our people and give it to the rest of the world. You know, what the learning that we give it to the rest. I think this is where, as doctors, we feel happy that we can do something and make a significant impact in lives of people. So I'm very happy that all of Apollo family teams, the stroke teams, will work 24/7. And the people, 24/7, Apollo is available. It's in full swing now. As I said already, you know, we didn't think of COVID, but it made a significant impact in COVID time, having had more than 15 million people who have approached it to see whether they have COVID. So, and had the doctor's consultations or medicines developed, tests done, all of these things, I think 24/7 has made a very big impact. So that will be a bigger asset to this program of great relief for an acute stroke. I think what is needed is media should give us this importance so that people know how to recognize that they have some deficiency, either in a headache or one of their limbs or functions lost. All these are easily available. All 24/7, the doctor will clarify for him. If it's a stroke, as easily as possible, we have made all our ambulances and cars free for people to when they want to reach hospital in emergency. So that also is not a handicap for them. Time is essence. So I wish that this program will make a significant impact in the lives of so many people. So we should say the deaths no longer in India is 1 in 4. The deaths probably is, we should say, 1 in 14. Can we do this? There's nothing that we cannot do. The smile on Dr. Sarish Chandra clearly says that the medical team, the whole team should work together. And Medtronic will continuously support with better and better technologies to make it as a great tool for people to stay well and then support their families, support the country at large. God bless all. It's a wonderful thing that we're doing today with Medtronic. I give my compliments to what they have done, what they are doing today with Apollo. I'm sure this partnership will make a significant impact in our vision from day one was the same, that we must give our people anything that's available for them anywhere in the world. We have done that was for cardiology. I think we are done in cardiology. We are now doing in stroke. I'm sure we have started in diabetes. In cancer, we've already done probably one of the best centers in this part of the world with the proton and chain of cancer hospitals. So I think it will continue to strive. But what is needed is people to act, people to know that that they should attend to that system. You know, this is where we are also moving towards prevention and early diagnosis, and started a program of health check called the Pro Health. If they have their Pro Health done, they will be diagnosed way earlier before they get a stroke. You know, this is where it will make a very big thing, where the media and the medical fraternity can together play a significant role in this. God bless all of us and bless people. Again, my sincere thanks for Medtronic and the entire team who's going to work in this. It's not just the doctors, the team who are working 24/7 in my stroke management. All the best. God bless.
Thank you, Chairman, sir, for the kind words. We would now like to open the press meet for a brief Q&A. For our friends from the media joining, you all can type the questions in the message box, and we shall direct the questions to the panel. And if you would like to ask, please raise your hand so that I can, line up the questions accordingly. Thank you. We have Mr. Dhananjay Kumar, who would like to ask the question. Yes, Mr. Dhananjay, please introduce yourself before asking.
Yeah, myself, Dhananjay Kumar. Good afternoon first. I am from Medicare News and a health writer of over 2 decades in Delhi NCR. I have 3 quick questions. First is, with Medtronic, is Apollo now fastest in India in tackling stroke? This is first question. Second is, why have you increased that golden hour time? And third is, could brain be reversed if stroke strikes it? Can brain be reversed with the new protocol that you'll have with Medtronics? That's one. No more.
I know Dhananjay Kumar, but Dr. Satish Chandra, I think, should rightfully take this question.
Yes, sir. This brain, what we are using, the Medtronic has given us is the evidence-based technology, which is the artificial intelligence. With this artificial intelligence, we are able to make the diagnosis in a fast way. And early diagnosis always revives the nerve cells. Otherwise, the nerve cells, as we have mentioned, is going to die very fast because of the reduced blood supply to the brain. So our objective should be to revive the brain as early as possible. With this AI-based technology, we are cutting down the time here. The time when it is cut down and we act fast, we are able to revive the brain. And that is what is the very, very important aspect of this AI-based technology. Since we have an evidence here already and it has been tested out, and we are using this for the first time in this country, Apollo group of hospitals, across the 10 hospitals, we are starting for the first time. Such a large scale usage of this AI-based technology is first in the Apollo group from India. I hope I answered your question, sir.
If I might come in here, and Chairman, if I might come in, Dhananjay, for the last 12 years, we've got a program called Apollo Clinical Excellence. So we collect data on 25 parameters that we believe are very, very important for our organization. And you'll be happy to know that we've been actually measuring the door to CT time for 12 years and have constantly endeavored to keep it less than 30 minutes. And we have also been measuring door to thrombolysis time and trying to keep it within 45 minutes. So from the time a patient comes in to getting a CT or an MRI and then going in for an intervention, 30 minutes, 45 minutes. And I think what this AI tool does is it helps us to bring down the time. And as we have heard, time is brain. And I think that to everyone at Apollo in our ecosystem is a very positive development. We will endeavor continuously to try and decrease the time so that we are able to use technology based on evidence to be able to deliver the best outcomes for every single patient 24/7, 365 days.
Sir,
Very important.
Dr. Simbal, thank you. Dr. Simbal, thank you. I was talking in the lingo of stroke. I asked the question, will Apollo be fastest? Fast is the lingo of stroke. So I wanted to know, will Apollo be fastest in tackling stroke in India now? That was my question.
Yes, sir.
Absolutely. I think absolutely. This is where we are following all of these door to CT scan for diagnosis, and then door to the intravenous injection to dissolve the clot. All of these are important. So the entire, you saw Dr. Satish Chandra put the whole flow of from the time the patient develops the symptom, how we will follow it, and the time is very important. And the second question you asked is, what after 4 hours also if they come, if the injection is given, if the clot is dissolved, the mechanical thrombectomy can be also done even after 4 hours.
And might well add, Chairman Reddy, that the trial name, Mr. Dhananjay Kumar, is DAWN, D-A-W-N. There is a trial which has studied patients between 6 to 24 hours from the stroke event. And it has also proven that the thrombectomy can be done with a longer duration of the golden hour. So if you're interested more, we can provide you that guidance. And the idea will be to bring the best state-of-the-art technology and to accelerate the timeline for treatment.
I know him. He has always been very
Thank you.
critically good person.
Thank you. We have a next question from Maithili. Maithili, please go ahead.
Hello.
Yep.
Yeah, actually, what is the advice, if the patient could not reach the hospital on time on the golden hours? What is the best advice, and what are the steps they have to take in between reaching the hospital?
That is a very important question. Here, what is required is the patient should reach the stroke unit or the stroke hospital at the earliest. All our efforts should be directed towards that. How can we achieve this? It is only by creating the awareness among the people that they should reach the hospital within the golden hour. And that is why the role of the media, both print and electronic media, is extremely important to create the awareness. And we are all working as a doctors in the society to create the awareness among the community. We create awareness, and with the awareness, patients should be able to reach the hospital within the golden hour. How we achieve it, that is what is very, very important for a successful stroke program.
Hello. Thank you. We have Genia. Yes, Genia, go ahead.
Yes, I have a question that can you please explain what should exactly AI technology do to beat the stroke actually?
An answer. AI technology is an artificial intelligence based technology wherein we are able to get the data out at the shortest possible time, as I put it in my slide there earlier. And it is able to condense that information, what we require to assess, evaluate the imaging aspects of the patient stroke, whether it is qualitative way or in a quantitative way. Where exactly is the stroke, which vessel is involved, whether it is a large vessel occlusion, and how much is the area is affected, which area can be salvageable, and with the quickest possible time, we are able to achieve that. And it even gives a graph of saying the volume of the affected area and also salvageable area. If we know that, we will be able to act very, very fast. And that is the advantage of having AI in quick decision making. And that is what is very, very important. Because whenever we are talking about any radiology, it is the skill of the radiologist who gives the information to us, skill of the neurologist which is there. But here, the AI-based technology, using this technology, we are overcoming many of these things, and we will have a standardization across all the radiologists and also the strokeologists to form and make the decision very quickly.
Thank you, Dr. Satish Chandra. Preeta ma'am, do you want to add anything to this?
It's very important in this situation, and there are 4 A's which we have to focus on globally. Everyone has seen this and they've seen it happen. Number 1 is there has to be tremendous awareness. So that is the first A. People will have to know, they will have to understand that these are the symptoms and they have to do it. Apollo, again, happens to be another A, but anyway, they have the largest, most efficient ambulance fleet and ambulance network. So within any given time, within 7 to 10 minutes, if an ambulance can reach, then we kind of get patients into the hospital situation in about 10 to 15 minutes latest.
then, you know, the golden hour comes into play and the cath labs come in. You know, you've heard about thrombectomy, you've heard all this. So this is action. And that is the most important day, that, you know, you have to act fast. The ambulance gets there, patient comes, or if the patient is aware, they come, you know, with their own means, but they come into our emergency rooms, which are totally geared up to handle such a situation. And then for the clinician's decision making, the AI, the partnership which we're talking about, the technology which is available, that the clinician will be able to decide that this is my best clinical protocol. I will go in quickly, I will go in fast, I will intervene. And that is how the outcomes happen. Because, you know, if you do not intervene at the right time, in the right way, with the right clinical decision support systems, then the patient doesn't get the best in class globally. And I think today is all about giving the people who unfortunately have a problem like this the best in class interventions. And so the 4 A's which come into play are the most important in this situation.
If I might just add, Cleo, one very important aspect that we like to highlight, we have presence across 16 states of India. We have 257 specialists in neurosciences with 10 training programs, training 41 in fellowship programs. And I think the scale, the size, the fact that we are a learning organization, the fact that we are adaptable, the fact that we adopt technology, I think is something that we are very, very proud of.
Thank you, sir. Do we have any other questions? Hello? I think there is one in the chat box that I can read. And it says, what will be how will this impact the consultant now with respect to the time and the decision support mechanism?
The consultant on a mobile phone technology can be used here. They need not be there available right at that spot. Wherever they are, using a simple mobile phones, this is transmitted across, and wherever they are, the decision can be taken and the decision is passed on to the doctor who are available at that spot, and immediate intervention could be done. And that is the advantage of using this AI-based technology by the Rapid, which is being given by the Medtronics now. And with this, definitely the patients are benefited, and the take-home message here is the quickest time and the fastest decision and implementation of the action, which is very, very important. And early diagnosis, rapid action will always reduce the disability and the mortality.
Thank you, sir. Are there any more questions from the media friends? I don't see anyone else raising their hands, and nor do I have any more questions in the chat box. I think that's about it from the media.
Hello.
Yes.
Yeah, so this is Uday from Mysore, sir.
Yes, Uday, please ask your question.
Very good. First of all, just want to congratulate Apollo for coming out with life-saving initiative. The thing is, but I think people lack an awareness about stroke. So the people should, more awareness should be taken up about stroke so that more lives can be saved. So on this initiatives, what are the steps Apollo Hospital is going to take in days to come?
We are already involved in this, in the stroke program, which is going on already. First, awareness creation. We are taking this awareness creation to create awareness in the community, among the doctors, and among our neurologist colleagues also. So what is Apollo is doing is now, first thing is to conduct the various programs, whether it is in the print media or electronic media, to create the awareness. And that is the first and the foremost, so that the people will be able to understand what are the common signs, what are the common symptoms, when they can think about coming as a stroke and approaching the right hospital at the right time. As Madam Preeta Reddy has already spoken to you, right timing is very, very important. The second group is we need to train all the colleague physicians. So we are all now taking a lot of CME programs, and also continuing education is going on among our doctors, friends, and this continues. And Apollo Hospital is always taking a lead in training the trainers. which are very, very important aspect. And the third aspect, among the neurologists also, since this AI-based technology is for the first time in a 10 hospitals are being started in very shortly across the Apollo group, we will be the leader. And once we take the lead, we train and also show the results to our neurology and neurosurgical fraternity so that they will be also able to take it. This is on a pilot phase. It started across the 10 hospitals. However, this will be scaled up over within a year's time, depending upon how much is available and what we are able to achieve. The goal is to spread it across as much as possible so that many patients across the country will be benefited.
So one more question, sir. Who are more prone to stroke and what are do's and don'ts?
Yes. What you are asking the question is about the risk factors. There are very well-known risk factors which are known to cause the stroke. The commonest among that is the hypertension, the blood pressure. Higher the blood pressure is higher chances of stroke. So then second is diabetes, which is very, very common in this country, which is almost 1 in 4 in this country are suffering from diabetes. Third one is the cardiac problem. The fourth is the obesity, that is overweight. And the fifth one is dyslipidemia. These are the common risk factors which are known as modifiable risk factors. So we can easily modify this. So our advice for the community at large is prevent the stroke. The prevention is very, very important. And we must educate the people on all these factors. And once this is prevented, the stroke prevalence will also come down.
Thank you. Thank you very much, sir.
Thank you. Thank you, everyone. Yes, sir. Please go ahead, sir.
As we are talking, I got a message from one of our doctors from Karimnagar. He says this morning a patient came because the wife realized that when he's smiling, his face was looking very awkward. So that he came to the hospital after giving the injection. He was perfect. Nice to get that message saying that it happened this morning in Karimnagar.
This is really great, sir.
Madam.
Great, sir.
Sir.
Okay, I think we have finished all the questions from the media and there are no more. Thank you very much to the entire leadership at Apollo Hospitals. Thank you, Mr. Madan, and the members of the press for joining us today. Our team will shortly share the press release to all the media friends. And in case there are any more queries, do reach out to us. We'll be happy to assist. Thank you and please be safe.
Hi, this is Masuma here from Medtronic.
Yes, Masuma.
I request all the leaders to stay on, including Mrs. Sunita Reddy and Mrs. Preeta Reddy. We can get a good photograph, which we can then share with the media.
Sure.
That'll be great. Also, Dr. Sibbal, please.
Sure.
Thank you very much.
Thank you.
Srimati Preeta and Dr. Hari Prasad, if you can also have the video, that'll be useful. Very good.
Hari is there.
Thanks, Madan. Hari and Madan, thank you for making it happen. It's really
Thank you. And
truly life-saving.
Matru Prasad and Balveer and the team.
Thank you for pushing it, Chairman, as always.
It's wonderful. I think it's a great thing that you are doing now, because this is one of the things which people don't give much importance till they become totally disabled. And that means after 24 hours, they realize that they can't move a limb or can't talk, whatever that there could be. But I think what is needed is, first, the people awareness should increase. And your technology working with you, I think will make it much more effective, that we can make a significant impact. And we are already in the process of training more and more. As Anupam said, we're training the largest number of DNB candidates. And this is one of those, the interventional neurology is one of those which we have concentrated on training more and more people. So I think all put together, and with Satish Chandra with his large experience working, we should also go to that level saying, what more can we do?
Sure. So before we just take a picture, there is a question that is coming from Mr. Narsimhan from Business Standard. He's just sent it on WhatsApp. The first question, and there are 4 parts to this, allow me to just complete. How the entire technology works both at the front end and the back end. The second part is, how will it benefit? For example, what level of time will be reduced? Third is, are you in a trial phase or this has already been rolled out across hospitals? And the fourth part is, will it increase the cost for patients?
I'll answer the last part first, and then Dr. Satish or somebody else can answer the first 3 parts. I think we need to thank Medtronic for this. We are not adding any cost to the treatment of the patient, despite the immense benefit that this AI brings to the patient. The technology is coming free of cost. The benefit of the technology is coming free of cost to the patient. They will continue to pay only for the services offered, the procedures done, but nothing in addition for the services that are being offered. And thanks to Medtronic and Apollo for doing this at no additional cost to the patient. The other 3 questions, Dr. Satish Chandra can answer.
Though this AI-based program, Rapid, is being used in a small way in 1 or 2 hospitals in the country, but ours will be the first large group, 10 hospitals across the country we are using for the first time, so that we will be making a big impact on the patients of stroke in this country. That is how this is a very important day for us, where Medtronic, joining with Apollo Giant, will be able to reach out to the many people across the country. That is a very, very important. The second important question, using this technology, the time is reduced. What is the time you are asking? The time which was taken about 45 minutes to 1 hour is being reduced 3 to 10 minutes. Within a 10 minutes time, the decision can be made and we will be able to act fast on these patients so that the golden hour could be utilized properly and in the best of the way so that the patients are benefited. The major problem in stroke is the disability, unlike any other disorder. So the disability has to be minimized. Minimizing the disability involves saving the neurons. As much as the neurons should be saved in a proper time, then only we can reduce the disability. And this is what exactly the time does. And that is the reason the time is brain, and the brain time has to be saved. And AI-based technology reduces significantly this time, and thereby the quick decision is taken and acted promptly so that the patient's recovery is very rapid and disability.
You were asking whether it is already there or is it in a pilot phase. It is started in 10 hospitals already, and it is working in a hub and spoke model. These 10 hospitals will be the hubs. And the example with Dr. Chairman gave just now about a patient in Karimnagar is a typical example of how a hub and spoke model works, because the patient came in at 2 o'clock in the night and there was no neurophysician on the campus. But thanks to the AI, they did do the MRI immediately, and the AI threw up a lesion. And the neurologist who was in Hyderabad at that point of time saw the films on his mobile phone and advised the emergency doctor in Karimnagar. And believe it, it was a miracle. Within 5 minutes, all his symptoms were disappeared. All the symptoms that he had, like moving of the ankle of the mouth, the eyes were not being closed properly. There was a weakness on one half of the body. All this disappeared in 5 minutes, and actually the patient is ready for discharge now. He's a 45-year-old young man and the single bread earner for that family. So that's the benefit that this whole technology brings about. So I just gave you this example to tell you that it is ready and it is working.
Inspiring, truly inspiring. And Mr. Narasimhan, it's also the surgeons and the physicians and the team working together. So that is what Apollo also brings in, with that deep expertise that Dr. Sibal and Mr. Hari Prasad mentioned. It's an integrated teamwork. That's an integrated or comprehensive collaboration with multiple teams, and that's what gives it the edge.
Thank you, gentlemen. We are ready for the picture. Saurabh, you can go ahead.
Kayu, do we have Sunita ma'am and Preeta ma'am on the call? Maybe they can also switch on their videos. It'll be great to have the two ladies also
Entire
on the
leadership.
picture,
Yes.
please. Yeah, thank you.
Saurabh,
So,
can you
Sunita.
check if Sunita ma'am's there? So I can't see her.
She's just gone on a call.
Oh, she's gone on a call. Okay.
Even Preeta ma'am is also gone on a call. So Nutan from IT is taking.
Okay.
May I request everyone to please look in the camera and smile so that we can get a good picture which goes to the media.
If you don't smile properly, it will go to the doctor.
You're done.
It's done. We'll share.
Thank you very much.
Thank you. Thank you once again.
Thank you. Thank you. Thank you for your
Thank you,
time,
Chairman.
sir.
Thank you all.
Thank you, Chairman, sir.
Thank you. Namaste.
Bye-bye.
Thank you, Mr. Madan.
Thank you, Dr. Hari Prasad. You've been the motive force. Thank you. Thank you, Dr. Chandra. Thank you, Chairman Ji. Thank you.
So, stop video.